Hi, my name is Dr. Thiagu, Consultant Obstetrician and Gynecologist. I've been based out here in Columbia Asia Hospital in Klang for the last 4 years. I have worked for the last 18 years and my job mainly involves delivering babies. I always get a lot of questions from my patients regarding a lot of unexpected things that happen during the pregnancy. As such, I'm going to answer some of those questions to you today. So come in, let's go. The most common reason for this is it's just too soon to see your baby. On a tummy scan, the earliest to see the baby sometimes is between 6 to 7 weeks. Rarely other causes include miscarriage or a pregnancy outside the uterus, which is also known as an ectopic pregnancy. For someone with irregular periods, it's always very difficult to identify the due date. The only way forward would be to do an ultrasound, and the best time to do an ultrasound would be between 8 to 11 weeks. I always get this question, why is it called morning sickness? Morning sickness. That's not really true. Despite its name, it can happen anytime during the day and quite often at night as well. Nausea and vomiting usually start at around 6 weeks and they usually fade away between 13 to 14 weeks. This happens in about 20% of patients. Out of this, 1 in 10, the nausea and vomiting symptoms do continue after 20 weeks all the way up to delivery. About 20% of patients have bleeding in the early pregnancy. The most common reason is implantation bleeding. This happens between about 6 to 12 days after conception, where there's a little bit of spotting and it gets patients very anxious. The less common reasons would be a miscarriage or a pregnancy outside the uterus, also known as an ectopic pregnancy. The causes of fetal growth restriction include the mother having high blood pressure, which causes the growth to be restricted, diabetes, sometimes the mother is just small size, so it is constitutional, it follows her size, and sometimes there's poor weight gain in the pregnancy. Itching is very common in pregnancy. It is thought to be due to raised chemicals in the body, mainly hormones. Also, as the pregnancy progresses, the tummy grows and stretches, and this can cause itching as well. Rarely, it can be more sinister causes, such as something called obstetric cholestasis. This is due to disease of the liver, and this is more serious and requires urgent medical help. It's very normal to have vaginal discharge in pregnancy. It's a protective effect. It prevents infection rising up the vaginal tract. As the pregnancy progresses, the discharge tends to get a little bit heavier. Constipation is very common in pregnancy. The main reason being progesterone effect. Progesterone causes the smooth muscles in the bowel to move much more slowly. The reason for this is so that the baby can get maximum absorption of the nutrients and energy. Iron also causes constipation, so that is something that we always tell to patients as well. As the baby grows, there's a lot of pressure in the pelvis from the growing womb. What this causes is it causes a lot of pressure to the surrounding blood vessels in the pelvis and in the anus, and this is how sometimes you can get hemorrhoids in pregnancy. We see more and more often these days. The numbers are increasing. What is the cause? The main cause is due to hormones produced by the placenta. and this inhibits the body from using the glucose effectively. As such, there's raised levels of glucose in the bloodstream. Age would be a biggest risk factor. Other risk factors include obesity, history of previous gestational diabetes, as well as family history of diabetes. Certainly, almost all pregnant women will lactate at the end of the pregnancy. The only thing to note is first-time mothers, the lactation may be delayed by up to 3 to 5 days, and in some patients they might need some intervention to unblock the duct so that the breast milk is expressed. This is very common and not to be alarmed. Hello? Okay, no problem. I'll be right up straight away. So that's all for today. I have a patient in labor, so I'll be going upstairs. But not to forget, our next episode will be on unexpected things that happen in labor. So don't forget to tune in. Till then, take care. Bye bye.